So what makes a good doctor? These kind of questions aren't unusual. Here they're looking at your understanding of who a doctor is, who a dentist is, and what makes them who they are. It's important to realize that actually the doctor, the clinician there, they're not just a scientist. They're not just fulfilling a scientific role, but they're also fulfilling that role of a humanitarian. They will be involved with humans, with people, in serving populations and individuals. So the human interaction is important. There are also people who have to work to and work with high levels of ethical responsibility. So in an answer like this, I need you to think about the various qualities, and I talk about them in my course. If you come to them, you'll find that we talk about a number of qualities. You can kind of split them up into three broad areas, and that would be the competence areas, the character area, and of course the contextual areas. Let me talk you through what I mean by those. So the scientific and the clinical competence area, what do I mean by that? A good doctor must, first and foremost, be really good. They must be proficient in the technical aspects of the job. Number one, that curiosity, that intellectual curiosity around lifelong learning. Medicine and dentistry, constantly evolving specialities. A great clinician is committed. They're committed to staying current. They will observe, they will learn about latest evidence. They'll be really good at critically analyzing things, i.e. research articles, evidence, protocols, guidelines. And they're continuously updating their knowledge and their skills. A really good doctor is also constantly developing their critical thinking and diagnostic ability. They have to be able to deliver that really well in order to be an excellent doctor, excellent clinician. Managing the complexities of, disease, complexities of what people bring as a human being, and be able to bring that together with data, with outcomes, with investigation and so forth, and be able to differentiate between the possibilities, i.e. possibilities around differential diagnosis. And then they should be able to make a sound and intellectual kind of decision, right? One that is clinically appropriate in terms of what they'll work on and what they'll take forward, their working diagnosis. They have to be technically proficient, right? Whether it's for medicine, whether it's for dentistry, you have to possess excellent manual dexterity skills, your attention to detail, your meticulous approach, if you like, to procedures, to guidelines, to the way you do things, because ultimately all of this affects one thing, and that's patients and their safety. That has to be paramount. The next area I want you to think about is the professionalism, professional character, and the humanism part of the work. These qualities, right, define the relationship between you as a clinician and the patient. This is what builds trust and facilitates the healing, the therapy. An excellent clinician will have superb levels of empathy and ability to be compassionate. If you can understand, if you can kind of share, if you can kind of bond well with the feelings and the thoughts a patient has, especially in times they're worried and they're distressed, that really trumps everything. A good doctor treats the person, and in so doing, they will manage the disease process really well. We don't see the person and just the disease, just a problem. We see a person and how we can help them out, how we can heal them, how we can provide therapy to them. A good clinician, a good doctor is also somebody who is excellent in their communication skills. Their ability to translate complex medical situations into situations that are easily understandable by everybody out there, using layman terms, using common terms so that patient can understand and they can kind of link in with you in a good level of understanding. They are really good at doing all this and then get informed consent so that it's not implied, it's not kind of pushed, It's not kind of stressed. No, it's a two-way process. Doctor-patient led consenting process. They're really good at managing patient expectations. They're really good at listening actively, i.e., what is my patient saying? What is my patient thinking? I'm going to incorporate that into the way I communicate and the way I deliver medicine. There are also people who may have core values and beliefs culturally, religiously, but they will not push them onto their patients. They'll be non-judgmental in the way they deal with their patient, no matter what background they come from, no matter what religion, what culture, what color, what wealth, what background they come from. Clinicians, doctors, are people with high levels of integrity and accountability. Fundamental, if you read up the GMP document, the GDC standards documents, you'll see that you need to be operating at the highest level of ethical standards. You have to prioritize patients' well-being above all else. That's your number one thinking. Within reason, of course. And of course, they're people, if they make mistakes, which they do, because they're humans, they're not robots. They make mistakes, but you know what? They're willing to admit their mistakes. They're willing to be able to change. They're willing to be able to apologize. They're willing to be able to learn. They're willing to be able to take what may come, but they will still apologize and admit when they're wrong. As a doctor, the other area that you need to be able to be aware of and talk about is context, systemic awareness. An excellent doctor, they can operate really well within the broader landscape of the healthcare system and the community in which they work. And that, as you can understand, will change depending on which part of the country you're working in, what kind of community you're working in, affluence, deprivation, rural, urban, island, non-island, small country, big country, developed country, underdeveloped country. They're able to kind of work in that environment depending on the team they're working with, the collaboration that they have to do. They recognize that they have to work as a team sport, as a team environment. It's not a silo culture. It's not a silo sport. So, doctors, dentists, you're going to be working with nurses. You're going to be working with, social workers, with specialists, with hygienists, with technicians and so forth. MDT, multidisciplinary teams. A good doctor is somebody who is humble in those situations, but effective as well. They can be leaders in there, as well as maintaining and working with the values of that team in what it wants to deliver. They can respect the contribution that other members of the team have to offer. They're not destructive, they're more productive, they're solution focused. There's also advocacy when it comes to context and system awareness. Advocacy, i.e. your willingness to champion the patient's needs. Your willingness to work for those, especially those that need you, that are underserved, that are in vulnerable positions, people who we need to reach out to. You are willing to kind of confront and address systemic barriers, i.e. social determinants of health inequality, right? What can you address that then will help improve healthcare outcomes? They also show cultural humility. I kind of leaned on that earlier on. They approach patient care with awareness of cultural differences. People have different ways of talking, different ways of presenting, different ways of kind of describing pain, describing discomfort, different ways of approaching mental health and physical health for that matter. You should be able to work with those differences in background and cultural kind of differences and religious differences, but yet be able to come out with excellent healthcare outcomes. So in summary, when you are faced with questions like this, you need to be able to show that the quality of a doctor, quality of a dentist relies on not just competence, i.e. sound scientific knowledge, but also a deep-seated understanding around character, the empathy, the ethical integrity that comes with the discipline of being a doctor or a dentist. And also the systemic factors at play, the context at play in terms of team and the population that you work with.